correlation or causation that patients who are in chronic pain tend to have lower omega-3 levels, and patients with higher omega-3 levels tend to be in less pain. So back to our big question, is it correlation or causation that patients who are in chronic pain tend to have lower omega-3 levels, and patients with higher omega-3 levels tend to be in less pain? Okay, so let's look. Mouse, no, rat, sorry, this one's a rat. I should have really differentiated. I found one that was a rat and one that was a mouse. So I didn't get confused. So this one here was an interesting study where they took rats and they had a rat model for hypertensive and a rat model for just a normal rat, a normotensive. What they did was they gave them omega-3 fatty acids, and then this is on the cardiovascular side of things, but they looked at, did the introduction of omega-3 fatty acids increase that cell migration that we've talked about before, the honing of mesenchymal stem cells to the areas of interest, so to the heart and things like that. And what they found was that there was an increase in the, did I flip this? Nope, this was right. That in the normotensive rats, there was an improvement in cell honing, which is going to be mediated through the CXCR4 protein, which has to do with the bone marrow and hematopoietic stem cells. But what they saw was a delayed response in the hypertensive rats. They still had a response, and they weren't, again, fully clear on why there was this difference. But again, this shows us that just because something might be good in one patient, it may not have the effect we want it to have in another patient. And so individualizing our treatments as we go along is going to be extremely important. And this may also be a point where you start to think, in the grand scheme of things, maybe if a patient comes in, they have hypertension, maybe we also need to address their hypertension in order for them to get a better response out of omega-3 supplementation for honing stem cells to an area of injury while healing. Here was a human study. So what they did here was they gave fish oil to patients who had exercise-induced bronchoconstriction, so they were asthmatics. They gave them 3.2 grams of EPA and 2 grams of DHA every single day for 3 weeks, which it's a pretty significant dose, okay? We're looking at 5 grams total of EPA plus DHA, which anywhere from that 3 to 5 grams of combined EPA DHA is roughly where we need to be in terms of the research on actually getting this anti-inflammatory effect. What I think is a bit more important, which I believe they looked at here, yeah, is the dose matters depending on how fast you want things to move. So what they found here was, and this was a placebo-controlled trial, so they looked at the fatty acid composition of this was for the peripheral blood mononuclear cells, arachidonic acid, EPA, and DHA. What you can see is that after supplementation, well, the placebo, no change in EPA, no change in DHA, no change in arachidonic acid. However, with the fish oil, dramatic increase in EPA, dramatic increase in DHA, and then super interesting is a reduction in arachidonic acid. So not only did the fish oil supplement increase omega-3 concentration in the fatty acid membrane, but it actually decreased the amount of arachidonic acid. Anybody know why that happens? It's competitive inhibition. Omega-3 and omega-6, when this cell is being made, compete for each other for those spots. So if in the blood your omega-6 is a lot higher than omega-3, that's what gets incorporated into the cells more often than not. And so with increasing the omega-3 through supplementation, there's more in the blood. more in the plasma, so that way when it gets sequestered to become incorporated into cellular membranes, it's competing against that omega-6, and so it's actually out-competing some of it to actually decrease. So not only are we getting the anti-inflammatory effect here, but we're getting a reduction in a pro-inflammatory effect. Now, I personally would love to know if the bulk of the improvement in these patients is because of a reduction in this or an increase in this. It's hard to tease those two out, but at the end of the day, it's still one single intervention. It just changed two variables. So we don't know which variable is most important, but we know that the one intervention was beneficial. And then specifically what they saw was a reduction in this LT4 and PG2 series, and then IL-1 and TNF-alpha. So an actual reduction in the inflammatory, which is more likely those findings due to the reduction in arachidonic acid, right? If you have less arachidonic acid, you're going to produce less leukotriene 4 series and prostaglandin 2 series.